Good day, dear viewers. I welcome you to my channel. My name is Marat Valeev. I am a cardiologist, and here we discuss health issues. It is clear that more often we touch on cardiological topics which concern the cardiovascular system. And today I would like to shed light on such a relevant topic as blood pressure, which does not need to be reduced. After all, when the pressure still needs to be reduced, at what numbers, what hypertensive crises, how to quickly lower the pressure, these questions are related to hypertensive disease, high pressure, hypertension. They are very actually relevant, popular, in high demand, and you ask a lot of questions on this topic. Today I would like to consider a few main cases when it is not necessary to reduce pressure after all. And most importantly, what you need to begin with is understanding that every person has varying pressure ranges. It is clear that certain limits are set, that is, as we are used to, 140/90 is the upper limit of normal pressure. But this does not mean that if you have pressure, e.g. 140 or 145 or even 150, you must necessarily lower this pressure. To begin with, every individual has their own norm, which can vary. Indeed, there are individuals who consistently experience high blood pressure throughout the day. There are no reasons, that is, no excess weight, no other factors, and they have a normal blood pressure of 140/90 or 150/100, and they live with this pressure for many years. These are, of course, quite rare instances, but such instances do occur, and I have come across them repeatedly. Thus, it is imperative to comprehend above all else that the normal pressure ranges differ for each and every individual. And most importantly, with age, blood pressure still physiologically increases. That is, if your blood pressure during your life was, for example, 120/130, then it is quite likely that by the age of 60, 70, 80, you will have not 120/130, but for example, 130/140 or 140/150. And for you, this will be normal pressure. It is very important, of course, in this case, to rely on overall well-being. If you have a positive feeling about it, there is no need to worry, and you should immediately take any medications, particularly without a doctor's prescription, especially if you feel good about it and have confidence in your decision. It is also necessary to accurately measure the pressure. If you measure the pressure after engaging in physical activity or experiencing emotional stress, it is highly likely that the obtained reading will be an inaccurate indicator. Therefore, pressure is measured in a calm, relaxed environment, without any psycho-emotional influences, without loads, preferably in a semi-sitting, relaxed position, and measured 3 times with an interval of 5 to 10 minutes, preferably on different arms, and the average value is displayed. In this instance, if you have adhered to all these subtleties and your blood pressure is higher than 140, then indeed you genuinely need to contemplate performing some fundamental diagnostic tests. You do not need to hurry to the pharmacy and purchase some medication. Please be extremely careful and cautious with this, because any medication has potential side effects, especially cardiological drugs. And it is necessary to understand that if you still start taking some medicine, then you will have to take it most likely for a very long time. Most cardiological medications are intended for long-term usage. I will reiterate once more, because they primarily do not treat illnesses. And yet it relieves symptoms. Therefore, there is no need to strive to take any particular medication. You still need to attempt to live without medication. It is also necessary to consider the fact that if there are such unpleasant factors in your life, for instance, factors that raise high blood pressure, such as smoking, for instance, excessive alcohol consumption, if you are overweight, that is, I am currently speaking specifically about obesity, not just about increased body weight, but with obesity, then it is evident that your blood pressure will be high regardless. And this also does not imply that you should promptly go to the pharmacy or to the doctor and take some medicine. You still need to make a conscious effort to collaborate with these factors, to work more accurately and efficiently, including in order to standardize and balance your lifestyle in a sustainable manner. After that, you can already analyze. Unfortunately, many people think that they will take the medication, but they will not change their lifestyle. Regrettably, this is not the situation, so primarily you need to attend to altering your lifestyle. It is also very important to pay attention to whether an increase in pressure is associated with any psycho-emotional factors. If BP rises, e.g. due to stress, at work, after intense experiences, it doesn't mean you should immediately take meds. This is not always necessary, and self-medication should be avoided. It is evident that in the event that the pressure surpasses specific limit values, which are above 160 and closer to 200. In such cases, it's better to reduce pressure. But I reiterate, if this occurs episodically to you, amidst emotional stress, you sense your blood pressure increases. Here you must address undoubtedly primarily with the nervous system. I would recommend, in order to make sure that yes, indeed, these are psycho-emotional factors, make a pressure monitor and watch it over time. Day, how your pressure jumps. If, roughly speaking, you are in a calm home environment and at night your blood pressure is completely normal, most likely you have some psycho-emotional factors that negatively affect your high blood pressure. In general, on blood pressure. If these psychosocial emotional factors are still present, I would strongly recommend that you, prior to taking any sedatives, seriously consider incorporating some form of physical activity into your routine or daily regimen. This can be the solution to the problem in 80% of instances. If this does not assist, then it is recommended to utilize Ingi in addition to walking, breathing exercises, presumably with the assistance of a psychotherapist or clinical psychologist, in order to attempt to comprehend these psycho-emotional factors that have a detrimental effect. And in the event that neither physical activity, nor breathing exercises, nor meditation, nor psychotherapists, nor clinical psychologists are able to help you cope with this, then undoubtedly it is appropriate to consider adding some sedatives to your treatment plan. Perhaps, I'll repeat once again, I'm not a supporter of this, but in extreme cases you can try taking some antidepressants if the situation is really severe. But I repeat once again, this should only be done under the supervision of a qualified doctor, because these medications need to be taken with special caution and understanding what it can lead to. Generally, I am in favor of examining things in a rational and reasonable manner. It is clear that there are some recommendations, there are some research, there is the opinion of doctors, that is, bloggers have a lot. That is, my opinion may not suit someone, and in some moments it may be wrong for someone. Therefore, always try to assess the situation sensibly, always pay attention to your well-being, to your overall well-being, to clinical manifestations, how you feel, and try to assess the information sensibly. Examine several sources. I came across information, but I want to emphasize once again that finding trustworthy literature on the internet is extremely challenging. It is hard to locate genuinely reliable sources due to the prevalence of plagiarism, and there is no guarantee that the information is accurate. Therefore, I strongly urge you to exercise common sense and avoid taking medications without necessity or a doctor's prescription. And I think everything will be fine with you. Don't get sick. That's the most important thing. Thank you for leaving your comments. Share this video with your acquaintances, friends, so that a larger number of people can have access to and benefit from this important information, and for a larger number of individuals to achieve good health and happiness. Farewell.